Good morning, everyone. I'm Ray Pucci, president of the Delaware County Chamber of Commerce, and I'm really excited to partner with Leaf and our other friends who you'll meet in just a little bit to bring you this important resource and strategies to support your businesses by strengthening your workforce. We are recording this morning's event. And we'll be broadcasting this on Delhi Telephone and Margaretville cable systems, as well as through the YouTube channel that the Chamber has, and we're going to make this available to anyone who's interested in having a copy. Business owners and managers, particularly small business owners, continue to experience stressors like never before. Just consider the last 3 years. First, government mandated that close businesses. Then they were allowed to open, but only with limited staff and lots of restrictions. Finally, that was followed by full reopening, only to discover that the workers that our business owners and managers thought they had weren't coming back. That mix of help wanted signs that are everywhere, along with an 3.8 official regional unemployment rate, is absolutely unprecedented. We're all trying to do more with less. And it's having a detrimental impact on your business, on your employees, and most of all, on you. So we're here to offer you some ideas, strategies, maybe even a little inspiration. In a few minutes, I'll have the pleasure of introducing you to Jen Gregory, who's the Executive Director at Southern Tier 8 Regional Board. She's going to help frame our conversation this morning by discussing workforce wellness as economic development. Dr. Joel Bennett, with Organizational Wellness and Learning Systems, or OWLS, will dive into some specific techniques that you can implement today. Dawn Laurette, a partner with Hinman, Howard and Cattell law firm, will give us an update on employee policies affecting substance use and recovery. And now for the inspiration that I promised. Julie Dostal, who's the Executive Director of Leaf, will share her experiences about the importance of work to our neighbors who are in recovery. Thank you all for joining us this morning. At the conclusion of each speaker's remarks, you'll have an opportunity to comment and to ask questions. Please write those in the chat message area whenever that thought may come to you. So, enough with introductions. Let's get started. As I noted a few minutes ago, Jen Gregory is the Executive Director of Southern Tier 8 Regional Board. That organization works with county planning and partner agencies to secure federal funding for economic infrastructure projects, community development projects across the Southern Tier. Through the efforts of Jen's team and with the support of the Appalachian Regional Commission, we're able to deliver this program to you. Jen?
Thank you, Ray. Yes, so can everyone hear me? Okay, great. Thank you. Thanks for being here early this morning. So I'd like to share with you just for a few minutes who we are and how we became involved with this important program. Let me just move that screen share out of my way so I can see. So the case for well-being and how we got here. So Southern Tier 8, the number 8 gives it away in that we serve 8 counties. We are the northernmost area of Appalachia. As Ray mentioned, supported by the Appalachian Regional Commission for those areas of rural disinvestment over the last 50 plus years. Congress recognized that. What you see there are SEDS, that's our comprehensive economic development strategy. So for the Appalachian Regional Commission and U.S. Commerce Economic Development Administration, we hold the regional 5-year plan for the 8 counties of Broome, Shenango, Portland, Delaware, Otsego, Schoharie, Tioga, and Tompkins. We look at our industry clusters and how the businesses are aligned across the region. Where's the investment and all of those different circles? If you look at the SEDS online, Kylene will post that link. If you look through the SEDS there, you'll see how those are described, those clusters, and how we can support business throughout those clusters. Each quarter, we hold a SEDS meeting, a sync-up session for our economic development, our professional planning, our chambers, and our administrative support teams for our resources across the region. Your representatives on the regional board for Delaware County, your legislative representative is Jeffrey Taggart. So hopefully you have his contact information. Sean Pencoff, under Glenn Nealis at the IDA, and Shelley Johnson Bennett in partnering in planning and watershed partnering. So as part of our 5-year plan, we started looking at this, at what are the needs across the region and how can we support those needs. So we held several broad meetings across the region. And what we noticed was our community well-being as one of the needs that we could focus and strengthen in the area. Gallup poll maintains a well-being index. And it was quite surprising when we looked at the statistics on that. They look at 5 categories to determine our well-being. The social rank, so how individuals feel in their own personal network. Financial, how are you doing economically? Because they know that increases if you have constraints on you or barriers to pursue your economic well-being, that can increase your stress. Where at the same time, if you're in a good place, then your security is increased and your stress is reduced. Your community. How do you like where you live and have pride in your community? This is key. This is what put us at one of the lowest rankings in that Gallup poll. And if you think about it, over the last 30 years, as we have had manufacturing decline, we've lost that community pride. You know, that's so significant because that guides in your own personal home and across the community how you feel about where you live and how you fit into the world, what you're doing. Physical, our physical well-being, having good health. We do have an older population here, and our purpose, getting up each day and liking what we're doing. All of those are determined in that ranking. So this was prior to the pandemic when we looked at this stats. The statistics that we've seen, to give you a sense, was what happens when you don't feel well. And a lot of this funding, you know, the political drive to support some of the initiatives when you look at well-being, that was driven by the opioid epidemic. Well, not only do we have the opioid epidemic, but what was more interesting to me is, so this is an outline of the Appalachian Regional Commission. And if I had a pointer, I'd be able to show you. Hopefully you all know you're in New York State, Northern New York State. But look at this. Based on this report put out by ARC in 2014, long before the pandemic hit, we are a bunch of excessive drinkers. So, you know, and I can share that a lot of our regional board, it took a minute for them to understand some of this work that we're doing. You know, there's that denial, oh, we don't have the opioid crisis here. No, but these are, you know, 10-year statistics that show that really we don't feel well about our community and our well-being, our home life, our jobs. So we're turning to alcohol to get through the day and when we get home. So I think that's significant when it's mapped here. That was very bold to me and in one of those oh no moments. So that became an interest to look into, well, something's clearly broken. So how do we begin to look at how do we fix this? And I wanted to put this website up here. So if you're interested in learning about more current statistics, where we are now, this Wellbeing Index at sharecare.com. And if you look up Gallup poll, it will also bring you here. So where do we fall with Delaware County? You know, I think for this, when I looked at the measures on the right, I don't want to be too alarmed, but we should know how we compare to the rest of the state. Most of this looked like healthcare access and housing and transportation. And some of that housing and transportation, there's not much we can do in an immediate to fix that. We're rural in nature, right? And don't beat yourself up too much about this. Tioga was ranked very low on this, Tioga County. And remember, a few years ago, they were listed as coolest small town in America. So I think a lot of it has to do with our age, housing, and transportation, but it's something to keep in mind as we look at our overall health. Oh, shoot, this image didn't come out as well. Thank you, Julie, for this slide that I used elsewhere. But as you can see, we're very rural in nature across these 8 counties. So that makes a difference with our housing and transportation. Something else to note for our region as a whole, and in particular Delaware County, most of our businesses are small businesses, right? It's when we think about small businesses, a lot of times that's been classified as under 100 as you look at census and Bureau statistics. But we're really looking at those smaller businesses that are less than 10. And thank you, Ray and Julie, 84% of the businesses we're talking to are less than 10. A lot of them don't have the resources that are available. So looking at that at 2017, 2018, we know, and then the opioid tick came up. I didn't include those statistics. If you would be interested in those, email me, I can share those as well. But luckily, as being part of the Appalachian Regional Commission, and that commission supports community and economic development programs across Appalachia. But they recognized, especially with the opioid epidemic, this is a crisis that impacts every family. I don't know of one that has not been impacted by addiction. So how can you have a good workforce if you're struggling at home with issues with that, or in the workplace, and facing that trauma itself? So looking at that, the other challenge we have in Appalachia is with that well-being low ranking over the last decade, we found that a lot of folks have migrated out of the region. So we have that reduced workforce. Ray mentioned historic low unemployment rate. Our population base, before you even talk about addiction, it's been reduced. The rest of the state was growing in workforce over the last decade by 10%. We're down 10% below zero. So we are really challenged with that. To put that into perspective, we're neck and neck with Kentucky, who just lost their coal industry. We're minus 10%. Well, New York State was 10% up in growth. we're part of the largest population loss across in the entire Appalachia, across those 13 states. So that's what we're struggling with. And that's why when you hear, oh, workforce development, we need employees. That's why, that's our challenge. So politically, policy-wise, those are the statistics we brought forward to our leaders, to Schumer, to ARC, and thank goodness they recognized that and saw that. So they said, oh, okay, not only do you have an addiction issue, you also have population loss. So what can we start doing with the folks that we have here? What can we do to support those that have faced addiction issues head on, that are in recovery, that are trying to grow where their talents are, get back into the workplace and heal? And how do we support that? Because workforce is part of that continuum of recovery. Workforce support, where you might have a family member where you say, I need Tuesday afternoons off. I need to address some mental health issues or appointments with your family. So how do we build that support? So we looked at the ecosystem development back in 2019 and 2020, and thankfully Julie was on that team. You know, who do we have in the region that's doing some of this work? That was the first step, because we've been involved in economic development. I really didn't know where to go with this. So I needed to take some time to understand who those leaders are. And I hope what you notice at the bottom of the screen, well, it started with the regional board, who we are with ARC and EDA. These are some of the local partners that we have across that we're willing to say, you know what, we're not really sure what you do. And Julie, I don't know that she knew who I was, but I said, would you consider going on this journey with us? And how do we bring the supports we have in workforce development for those working in prevention and recovery, and support those efforts and your patients, your clients, your friends in recovery? So I just want to take a moment to acknowledge, because I certainly did not do this alone. The Family and Children's Society up in Cortland, Lisa Herschel and her team were very helpful. Bob Murphy at Broome Tioga Workforce, the investment board. Although you see Broome Tioga on there, what we've been able to do over the last several years is expand that program across the region. So I'm working with him and Alice Savino at CDO Workforce and Amy Buggs at Portland Workforce to work on another proposal to continue this work and expansion. The council, Angela Sullivan, Stacy Cangelori up in Tompkins County, and they just opened their center a week ago. Kowalik and Associates, Tom Kowalik, he not only did he help me with the 5-year plan, but as a veteran-owned small business, he had that relationship and understanding of businesses that I don't. What do I know? I'm a bureaucrat in an organization. Julie Dostal and Kylene Johnson at Leaf. Thank you for your understanding, Julie, and understanding all of these terms and acronyms. That's the other side of it. Not only were we different organizations in different parts of the ecosystem, but also our own set of acronyms for all of this. And Stacy Duncan at the Leadership Alliance, running not only the IDA for Broome County, but also the chamber, as well as Ray Pucci, the chamber president of Delaware County, as well as Bob Haight in Cortland, and other chamber presidents across the region as we've worked with. So we spent a year assessing the challenge, saying, what do we do now? So we came up with some various strategies and put them in an application. ARC launched ARC Inspire, an initiative to help folks working in this workforce development and recovery to work program. And fortunately, we were selected as one of the first local development districts to pursue this initiative. That gave us the opportunity now having some funds that we didn't have exposure to build upon our peer counseling and to bring in professional help from across the country. Julie said, wow, check out this organization, Organizational Wellness Learning System. They work with larger corporations, federal government. How do we get an opportunity to help our small businesses learn? ARC gave us the investment to make that happen. So I'm very proud of that, very humbled by the work that Joel's been able to do. So one of the first steps we took was, okay, intuitively, we have all of that federal ARC data. What does that mean locally? Do we really have all of those problems? So Joel set out on a very aggressive schedule with a phenomenal team of statisticians to survey our small businesses. And did that from November 2021 to February 2022, right after the pandemic. Thankfully, I know everyone was strapped as they're building in the recovery from the pandemic. We did have 238 small business owners, CEOs, managers that were willing to respond to this survey and talk to us. And what we found was, oh, yes, indeed, we're in need of employees. Everyone needs help. But what we also found was that how much time the manager, the CEO, the small business owner spent dealing with mental health issues. That was an eye-opener for me. I understood about retention, but I didn't think about it in that way before. Wow, that's a lot to lose 50% of your time. So think about it. If there's 20 working days in the month and you're losing 10 focused on dealing with HR issues, how productive can your business be? How productive can you be? How productive can your workforce be? You're already cutting your time in half. That means you're cutting your productivity in half. And the other bit of information that we learned that surprised me, because we live in our world and we only know what we know, right? I didn't realize in Appalachia, across those 8 counties, we have 2/3 less the resources that they do in the rest of the state. So when we know we have these issues and we have a smaller workforce, now we have less resources to address those challenges. And the other interesting takeaway from this report was that going back and thinking about, in the Broome and Tioga area, we have very large businesses. We have the larger hospitals. We have the larger school system, SUNY Binghamton, Ithaca. We have Cornell. Those are large institutions. Lockheed Martin, BAE Systems, those engineering types and larger corporations that are nationally based. So they have some resources to deal with that internally. But our smaller businesses don't. It might be you and your husband, you and your partner, and maybe 2 or 3 other employees. What sort of resources do you have? You don't have an HR department that you can call. You have to figure it out yourself. And in doing so, that costs you 3 times more than it costs those larger corporations. So you're really more in need than anyone else. So if you'd like to learn more about it, on the right there, that strategy is there right from our website. That resource is there, as well as if you would like to look at the medical statistics. Joel's team broke all of that out, graphs, reports that those in the medical field will understand. So you can really take a look at that on your time. So what are the managers and CEOs? What is their focus when they're spending their time dealing with employees? And this was scaled down to the 39% for the small business of time. stress, burnout, those deeper mental health concerns. That leads to a lack of sleep, so everyone's fatigued on the job. If you have a small contract manufacturing firm, that's not good for business if they're running machinery or driving across our area, driving an hour or two in the day to get your product there, or running the farm equipment and running that over to Cade so they can run it to New York City. That has an impact, as well as general health. And we know, what do you do at the end of the day if you're really tired and you're ready to give up and you don't have that support team or that pursuit in the community? They're turning to alcohol misuse or other drug misuse, as we're seeing. So the key findings that you'll see in that report, when you're losing 50% of your productivity, you're losing 50% of your financial. You're reducing your bottom line before you even walk through the door that day. The leadership, your mind, your thoughts for your growth, for your organization, promotion on social media, all that's a distraction because you're losing your time on those health concerns that we mentioned. So you're distracted as well. You don't have those resources to deal with the situation. So what are our needs out of that? Training. How do we learn about this concept of well-being? And then how do we roll out different programs throughout our workplace so that not only we can do better, that our team can do better to manage stress? How do we help them with those softer skills throughout the workday? What was also mentioned for needs or improvements with the well-being program, addressing the opioid misuse or prescription pills. So if you're tired, and a lot of this is innocent. Over the last decade, we didn't know how addictive opioid use was. So if you were on site, tired, injured, then the doctors did prescribe this medication. And if you didn't know about it, it was easy to become addicted. That's part of what our team, everyone that's on this slide here, we said, we have to reduce this stigma because this opioid epidemic, the alcohol use, that's all something we easily could fall into without paying much attention to it, without realizing the risk that came with that. So the respondents from this survey looked at education would be very helpful to help us even understand the issues we're facing, understanding that this is impacting everyone, and taking measures on how to become a more wellness workplace environment. Because the bottom line is, it's really scary when you look at the math. So as we said, that has a larger impact on small business. And thank you, Julie, for this slide. What that means to a cost of your small business, $25,000. That could be, or greater. That's the estimate. What does that mean in employees? $100,000. Think about what you could do with an additional $100,000 in your business. Those numbers are larger for the larger businesses, but if you dive into Dr. Bennett's report there, he spells it out, the details of that impact on small business and how that still has a greater impact on your bottom line than the larger business. So it's something to really pay attention to, and this is the economic development impact on them. So thankfully, through this work, through working with Joel over the last 2 years, he trained a team with a workplace wellness initiative. So out of Lee, Julie and Kylene are leading that. This is the start of that program. Well, we've had over 200 employees trained so far. Now is the expansion, and thank you to Ray. He was willing to host this and say, you know, here's what you need. I read the report. I see these are the needs that you have. If the chamber can help you with this wellness training program, we're here. So this is the launch of that. So that's all the boring background. The hope is that going through the team awareness program, that you become a better business owner. You have a better perception when you get up in the day that you have less of a challenge to deal with. Of course, that's an improvement in your attitude, what we call better mental health. And with better mental health, better overall health. Maybe at the end of the day, it's nice in spring, folks get out, that you have alternative solutions to bring to your workplace for your employees. That in turn will lead to better reception for your customers and your clients who you serve through your business. And key, when you start some of these measures, then your employees, you start talking better and it becomes a better workplace for attraction. That's where we're looking forward to this expansion, that we'll see more and more cases. You're going through the training now, you'll go through training, maybe you'll become an advocate for this sort of work. And folks will get to know your business and say, that's a place I'd really like to work. Because not only do they care about the bottom line, they care about their employees. In turn, there'll be less workplace issues. In turn, we know how much it costs to hire and rehire. So the goal is to reduce your turnover and end up with longer lasting employees, therefore reducing those expenses and costs. And as a whole, as your business improves, improving that better community well-being. So when we look at that Gallup poll, we're no longer in the bottom. We want to see that number in Delaware County rise to where the southern tier is higher on that goal. So those are the goals that we're setting with this. And I'm excited that you're here to consider being part of this. This is just the start of it. LEAF will be there. And hopefully there'll be more in programs. And as you go out, share the message with others. So thank you, Ray, for hosting this opportunity for all of us to get together today. Oh, you are muted.
I'm sorry, I thought I got that. Thank you for that. Thank you, Jen. Are there questions, comments for Jen Gregory from anyone? Jen, I have a question. You mentioned in your presentation that the counties within the Appalachian region of New York State have 2/3 of less resources than the rest of the state. What do you mean by less resources? Can you quantify some of those that you're talking about?
Sure. So most of those, what we found going through this, we don't have an EAP. When you have this larger businesses, they have the human resources to offer services. If you run into an issue with your family, that's someone you can call and talk to. How can you find a mental health provider? Most of us don't offer that or have that opportunity there. The other resources, so I showed, and we're going to come out with our first ARC investment with Inspire. Well, we're wrapping up some of that. She's taken on one of those investments. For we're developing a directory of resources across the southern tier. But as you look, those treatment facilities, they're scattered throughout the 8 counties. I had to look to find Julie and Leaf, and she's the only one doing what she does across those 8 counties, across the southern tier. New York State is is just getting involved in this sort of work. And we've raised the awareness. Julie sits on the state team because they're looking at this. There are more resources that can come about in New York State, but it's so limited that we're drawing to those. You know, the council, as I mentioned, they just opened last week with beds. And that's been a multi-year investment, a decade of work to do that. You know, where some of the larger urban areas have that. And then when you talk about, so that's like big level, but then you think, how do the folks get there? We don't have the public transit that many areas do, or the ability to even get to these resources. So all across the board, there's another chart I had, but I didn't want to talk about the doom and gloom of all of it, but all of the components in the ecosystem that can support that. We just have less. So we're trying to build that, raise awareness for that, and hopefully at the policy level in the state, more funding will come about. We'll see with the opioid investment across the state, how that rolls out. That prevention and education, that's always had a reduced budget in the state. So we're hoping this work will raise awareness to increase those opportunities for folks.
Great, thank you. Anyone else have any comments, questions for Jen before we keep moving along in our program? Okay.
Sorry, I ran a little over. Thank you.
Well, I have to say, as Jen mentioned, that I've been very happy to be part of this effort over the last several months now, and probably one of the real pleasures for me that has come out of participating in this program is that I've gotten to know our next speaker a bit. Joel Bennett he's my kindred spirit. Dr. Joel Bennett is the president of Organizational Wellness and Learning Systems, or OWLS. He's going to talk about how we bring together workforce protection and wellness promotion for small businesses. And I'd be remiss if I did not mention Joel's latest book, The Connoisseur of Time, is available as a free download from presencequest.life. And Joel, I love the fact that you have that on your Zoom ID now. So with all that, I'm thrilled to introduce to you Joel Bennett. And you're muted, Joel.
Yeah. No, thank you, Ray. Having worked with small business development and small business incubator and small business accelerator programs, I've been told to put my logo, name, downloadable on everything I do, right? So I am an entrepreneur. And Ray, are you proud of me? Right. Take the hint. So yeah, there's so much to talk about. I'm noticing it's now 9:40, correct? And this goes till, how much time do I have to steal here?
About an hour.
Okay. Well, I have a slide deck, but I first have to say that sometimes we don't see the forest for the trees. And Jen, she just shared so much about this effort and how many players involved in this effort. And I want to just acknowledge Jen for her leadership. This would not be possible without that oversight, and if I want to say that the clout of economic development. It is sometimes difficult to see the context here. This project is very unique. There's not many projects like this throughout the country, where many stakeholders are brought together and meet and share their experience, their knowledge, their wisdom, and show care to do something about the problem. Very often, workplace health promotion is coming out of a corporate mindset, a for-profit mindset, a not public health mindset. And guess what? When you're coming from a corporate mindset and not a public health mindset, the people who really need this, i.e. the smaller businesses, the people who work in rural America, the people who are most hit by the obesity epidemic first, right? The COVID epidemic, right? Those are the people who don't get this. So there's a lot of hoopla out there about wellness and health promotion, but does it really get to the people who need it? And I think that can only happen with the kind of leadership that Jen has and her wisdom in working with Julie. And I'm not just saying these comments to be nice. I mean, it's real, okay? This cannot happen without that. And so what I'm about to share then is some of it will be a repeat of what Jen said, but it's really meant to show you who you are and what you have done as a region and to keep that story going. You know, a lot of the research about the effectiveness of this work, which is why we're here, doesn't really land on the ears of leadership. What lands on the ears of leadership are stories. So what I want from you today is to share this story as much as you possibly can to the people who can make a difference, because there are people out there right now in Delaware County who are contemplating suicide. No question. There are people out there right now in Delaware County who are not going to work because of a hangover. There are people out there right now who are suffering because of spouse abuse, child abuse in Delaware County, and they have no idea that there are resources available to them. And when those people look for work, all they care about is making $1 so they can cover whatever bills they have. But once they go to work, there may be an opportunity for them to hear this message. And because it's not coming from anywhere else, they're not hearing it on Fox News, people. Okay? They're not hearing about health promotion and safety on public radio, right? If they're even listening to that. So the import of having the message go into the workplace, whether it's the business, whether it's the chamber, whether it's workforce development, whether it's economic development, whether it's the guy you happen to know on the board of some nonprofit who might be interested in doing something, whoever it is, those are the people who need to hear this story. So it doesn't really matter what I have to say if you don't resonate with the story. So that's my job today, is to give you enough material. And by the way, I have to say something because Julie has taught me this. I can sometimes come across as passionate, and that can sometimes offend people. I am sorry if I come across like a passionate person who's telling you you have to do something. My apologies. Can you all hear that? Caveat. Caveat. All right. So Julie, should I keep going or should I stop? Okay. All right. I actually prepared slides. Let's get going here. I hope I put the right slide. Yes, look at that. Okay. So this is the intersection of workforce protection and wellness promotion for small businesses. And that'll become clear what I mean by that as we move along. I do want to say that we have been fortunate to receive funding from Jen Gregory and ARC to deliver a manager resilience training. And we just finished our 3rd training. We've gotten very positive response to this. This is the workbook for that particular training. And I'm, OWL's Organizational Wellness and Learning Systems was able to put this together because of the support from Southern Tier 8. And the reason I'm showing this to you is that not only is this an asset that you can continue to use, but it makes this distinction between managing and leading. And it's the same distinction I'm talking about. Managers are not about telling the story as much as they're making the story. It's the leaders who tell the story, right? So that's where I'm going here for your benefit, is how can you be a leader? Now, this is the description. The economic, quote, health of small businesses play a vital role in the health of local communities. I think that was very clear from what Jen was sharing. However, small business owners have always faced multiple stressors from working both in and on the business. If you're the smaller the operation, the more you have to do both. The larger the operation, you can get away with just doing one. So the stressors accumulate, and not only do they accumulate for the smaller businesses, they've also grown in the past year. And that includes whether you're a solopreneur, a quote, midterm micro business, or a mid-sized traditional manufacturer. And I'm going to share with you a case study. I'm going to upload a case study that we did for a manufacturing organization through support from Jen in Cortland County, where we worked with a manufacturer. Health protection and security programs involving safety, cybersecurity, regulatory awareness, they represent only one side of the wellness equation. So there is a lot of safety and security efforts. The introduction of broadband comes with it all kinds of security, additional measures. Cyber issues are growing, financial security, safety, not just in terms of manufacturing and working in safety sensitive positions, and frontline workers. That's where a lot of the money goes. A lot of the government's funding goes to dealing with these types of issues, safety and protection. We now know that that is lopsided because leaders themselves, as Jen shared, are suffering. They're suffering from their own health problems, their own stressors. So why are we spending all this money on infrastructure and ignoring the human side of the equation, especially for leaders who have a major impact? And what we've seen is that it's the economy, employee apathy, techno stress, social media pressures, COVID-related employee turnover, political and racial strife. Well, guess what? It doesn't only affect you and me. The same leaders that we're talking about here, they put on their pants every morning just like you and I do, right? They're human beings. Why would you think it doesn't affect them? And in fact, I had a chance to talk to some Fortune 100 chief human resource officers a few weeks ago, and they told me they're concerned about their CEO's mental health. They're concerned about their CEO's mental health. You won't hear about it, though, unless you do an anonymous survey, which is what we did. So we're orienting you to this. Now, this is a slide. It's a graph from a chapter we did for an edited book for industrial organizational psychology that came out, I think it was 2014, using industrial organizational psychology for the greater good. On the left, and I know this might seem abstract, but it's very important because this, what I'm about to show you, is what has been happening in the Southern Tier through Jen's efforts and Julie's efforts and Kylene's efforts and Ray's efforts. The level of focus of any health promotion could focus on the individual, it could focus on the group, or it can focus on the organizational. So there are levels of focus. And why this is important is that after 9/11, the 9/11 Commission and the Homeland Security issued a report about resilience in the United States. And in that report, they said the only effective resilience strategy that could ever work to keep us from having to face 9/11 again is a multi-level focus. You can't just focus on individuals. You also have to focus on teams, the groups, the organization, and families, and so forth. So those are the focus levels. Now there are promotion elements. So you can make a program effort, right? Deliver a program, sort of like what we just did with those manager resilience programs. You can have an environmental strategy, which is more, how can we change the environment so it's easier for people to make the healthy choice? The classic environmental strategy is you limit the number of alcohol outlets in a particular census area. You limit the amount of tobacco outlets in a particular area, environmental strategies. And then there's policy support. How can we, for example, with tobacco, you cannot smoke here, would be a policy support. A policy support would be the New York legislature saying so many businesses in a particular county have to become recovery friendly. That would be a policy, okay? If you want money for your county, so many businesses have to be recovery friendly. That would be a policy. That isn't happening, by the way. But with Jen and Ray on board, it'll happen within a few months. Okay, so what you have here is this grid. And I want to share with you that if you look at this grid, wellness typically occurs here. Okay, weight loss programs, gym memberships, incentives for participating in some sort of health promotion program. It's an individual programmatic effort. Safety efforts typically occur here. Organizational environmental strategies. You have to wear your hard hat. You have to have so many guardrails. Is this clear? This is what I'm sharing here. Any questions about this? So what's missing, and what team awareness is, and what Julie has, and what the resilience training has, is the actual sweet spot, which is here, what we call the we in wellness. Working with teams, working with groups, and that includes you. You are a de facto group. The 11 people on this call you are a de facto group, by the way. So every chance you have to bring people together, you have a chance to focus on everything at once by bringing awareness to how the team works. So that's what this is. And this is what works. And it's what's missing. So for a quick outline, and I don't know how much I'm going to get through here, I think it's important to tell this story. And the first part of this story was the significant amount of capacity building that we did. And I'll share some of the results of that. We worked with the Delaware County Chamber. We worked with a number of chambers in the Southern Tier, the Finger Lakes region, Central region. We conducted interviews and we conducted focus groups. And we did this through outreach efforts that came out of Julie's work, Jen's work, and also we did some work up in Monroe County with an NCAD DePaul. And we reached a lot of great stakeholders. We reached many people in public health, people in workforce development, chambers. Ray was one of our stakeholders. That's how this happened. It was Ray's input that led to the rest of this triangle here. The next thing we did was that leadership survey, and we got multiple publications from that. And we have another one coming out. And that was a survey that Jen already described. And then we designed, trained, and delivered programs. And we've reached over 1,000. In fact, Eileen, I think we're getting close to 1,500, if not 2,000 at this point. And after I heard about what's happening this week, we might be at 3,000. Amazing, amazing. And so there are results there. But it all comes down, so what? The all of this is the push to you now. So if you're listening to this and you're going, I'm not a small business, I don't know why I'm listening to this, you probably know somebody who is. So that's who you have to tell this story to. And I hope we'll have enough time to do a sample training, but I think it's the story that is the important thing. So let me tell you about capacity building. By the way, all these pictures here come from my friend Google and the Delaware County Imagery Bank. I don't know, what is this place, by the way? What lake is this?
Joe, we don't have lakes here. That looks like one of our reservoirs or
What?
one of New York City reservoirs.
You mean it's water that you guys give to New York City?
Essentially, yes. So you grew up on New York City water, certainly out there in the Rockaways. So you have Delaware County as part of viscerally part of you for years.
And now you know why Ray and I get along so well. Okay, so needless to say, that water has. Thank you, by the way. Thank you, Ray, and thank you all in Delaware County. Needless to say, this has led to my brain development, which is what allowed me to do this. So thank you again. Stakeholder interviews, we did 18. We did focus groups. At that time, we had more than that. And we did the multi-county survey. So what we found from the stakeholder interviews was we've already shared. You know, we actually heard a lot of the leaders said failures in empathy. Failures in empathy. We heard from the workforce about that employers are not listening to us as much as they're just piling on more work. And this was all before this whole idea of the Great Resignation. We were doing this in 2021, lack of community connection for healing. And the solutions they told us were take time for listen, take time to reconnect. We need to connect again. We need to connect not only with ourselves, team, we in wellness, but we need to connect public health. We need to connect to community efforts, and we need to connect business, and we need to connect them all together. That's the story, to build resilience skills and to reactivate a choices mindset rather than resignation to the problem. We have choices to make here. Let's not bury our head in the sand. That's what everybody told us. I'm not going to go into a lot of detail here, but when we did these interviews, including Ray, we asked them these questions. You know, how frequently do these issues impact business performance? And you can see that over here. That was the question. How frequently does an issue or a concern impact business performance? So you can see very frequently or often, work or health issues impact performance. Mental well-being issues impact performance. Substance misuse issues impact performance. Okay. And now on the other side, though, we asked, well, are employers actively seeking to prevent these issues? Not so much. So there's a disconnect. And can employers serve public health of the community? Well, there it was a little bit higher. So yes. So what this data suggested to us, and these were stakeholders, like I mentioned, this was our first aperture into seeing what's going on in this area. And what these leaders told us, again, directors of chambers, directors of workforce development, directors of public health, we had some government officials. They said, there are problems out there. Employers are not doing a lot about it, but they can have an impact. So that's the leadership story that we have to remember. All the other data that comes is designed to support that, but the story is to appeal to leaders and help them to do what they can. Now we've given them tools. That's why Julie's here. That's why Kylene is here. Why will we spend 2 years developing tools for the people who said that they needed them if they don't get used? Focus groups. So we actually went and did a deeper dive, and we asked these focus groups to sample some of our training programs. And we did, inside the focus group, we actually did a sample training, 30-minute, just a 30-minute training. And what you see here is that all of these data show increases. Even with a 30-minute training, people felt they can have more resilience. They know that there are ways that they can get help. Okay, so we knew that we were onto something consistent with what we've known about from our previous research. And would you be willing to participate? Once this training module is created, how likely will you attend? And you can see some of the results here. So we were finding that not only were leaders telling us that there's a need, the employees were also telling us that this was valuable. So then we did the survey, and again, I'm not going to repeat because Jen already gave a lot of information on this. I think the heat map on the left shows you a good idea of where we surveyed in terms of zip code. So we had a pretty good reach, and you can see the size of the organization. We had some really good, micro 1 to 10 employees, right? 40 of our participants, right? Here were micro, 53 were less than 50. So we were really excited that we got such small participation, and small business participation. And we're able to look at that in more depth. This is just a repeat of what Jen had shared earlier, that the leaders said that their financial, health, and productivity problems were caused by employee stress and burnout, lack of sleep and fatigue, and so forth. And they told us what they wanted was, and we developed, well, guess what? You actually saw a manager training on stress. That's what they wanted. You want it? We got it. We gave it to you. You got it now. What are you going to do? Resilience, communication. So these were the programs that we worked on. Okay, survey results. So I know Jen has already gone over this, but I think there's one particular piece that Jen referenced briefly, but it really does require highlighting. And the phrase you would use is, small businesses are more vulnerable than larger businesses to mental health concerns that they might have in their employee population. They're much more vulnerable to it. And accordingly, they have more to gain. So the phrase we use is more vulnerable, more to gain. More vulnerable, more to gain. More vulnerable, more to gain. As you'll see, leaders in larger businesses, they may overall have more economic burden, but because they're so far removed from their employees, it doesn't hurt them as much. So it makes sense. If you've got 5 employees and one of them has a mental health problem, that can kill your business. If you have 50 employees and you have one person, or you have, it's going to be less likely if you do the math, right? If you have, and I could tell you stories of people in recovery in smaller businesses who come to work because they develop a relationship with a business owner. They have a substance use problem, they go out, but they have a good relationship, so the business owner welcomes them back. And that goes on and on for years. That can go on and on for years because of the compassion of a small business owner. So without going into this, this is a mathematical chart, and this is going to be difficult to understand without the graphic that's going to follow, but I want to clarify. What we asked was, how much were you exposed? How much were you exposed to employees' mental health problems? And we counted the number of exposures. Were you exposed to employee? What are your problems, financial problems? How much were they due to stress and burnout? How much were they due to fatigue? How much were they due to depression? How much were they due to alcohol? How much were they due to drug? And we looked at the number of exposures. And what you're seeing here in this particular column is the correlation between the exposures and average annual costs due to taking time out of your work. So you can see these correlations here were lost administrative time and lost labor productivity. What I want you to notice is that these correlations are significant for the smaller business, R41 and R55. Don't worry about whether you understand correlations. It'll become clear as a bell as we go to the next piece, but these correlations are not significant for the larger businesses. So while, of course, they're spending a lot more money in the larger business simply because of the economies of scale, but the vulnerability piece is the thing I want to emphasize here. And that you can see here. On the left are the smaller businesses. On the right are the larger businesses. This horizontal axis is average mental health related exposures. This is how much money you are losing in your day-to-day work. This is, again, how much exposure. This is how much money are your employees losing in their work. The only thing to notice here is that this is a significant correlation here and here. But over here on the left, nada. So what this shows clear as a bell is that the smaller businesses, those businesses of less than 100 employees, the more problems they face, the more likely they're going to have to close their business. That's what that basically says. And nobody's doing anything about it. So what I want to also share with you is why it's so important for Delaware County. Robert Wood Johnson every year does a county health rankings, and this just came out for 2023. And you can see the link there, countyhealthrankings.org. And I'm not going to be able to go into depth on this. And of course, I know we're not just talking about Delaware County, and you can look at the surrounding counties, but I'm going to focus on Delaware. Delaware County, of the 61 counties in the state, ranks in the lower half. You can see this ranking here. If you look at the this, so ranked 4862, that's the worst. 32 to 47 is that lighter green, and that's Delaware. What's important, though, I think, is look at the surrounding counties. Broome, Chenango, Sullivan, is that right? So, you know, you're still vulnerable, right? I mean, it's like, how many people work in Delaware County that come from these other counties, and how many people in Delaware go to these other counties? So you've got to work. I have to emphasize the leadership with Ray talking to the people in these other counties and making the region healthier. Broome, as you'll see in a moment, is got its own set of problems. But that's just it. It's not about any one county, it's the region. So these are the rankings, and these are the health rankings. And you can see they're in order from the healthiest, which is Putnam, which I have spent time in, by the way. Yeah, I grew up in Nassau County because of Lawrence right there on the border. I went to school in Westchester County. So, you know, I had it pretty good. Okay. Queens is 12th. So, you know, but, you know, you can see where it is. By the way, we are working with Cattaraugus County, just so you know, in another project. So these are the county health rankings based on data that's collected through Wisconsin Public Health and Robert Wood Johnson. So take a look at this, and anybody want to comment on what they're seeing here? Any comments about this?
Joel, it's Ray. I certainly, when you talk about it as a region, look at that column all the way over on the right-hand side. You know, you mentioned Cattaraugus, but we have in our region, Sullivan, Chemung, Chenango, Broome, Greene, all fall in that right-hand column. And those are all, you know, neighboring, to some degree, neighboring counties. So I guess I feel pretty good at 46.
That was my goal. My work is done.
Yes.
Joel, do you know what kind of data they collect?
Oh yeah, it's all, you can go there. It's so much. When you go follow that link,
I was just curious.
It's all public health data. In fact, I'll show you some of it now. So I forget the exact place where they get it. Some of it's behavioral risk data. The key here, so yeah, if you follow the link, Eileen, it goes into quite a lot of depth on where county health rankings. So for us, the key here is that poor mental health days, right? Compared to the rest of the state and compared to the United States. That's one piece. And the other piece is number of mental health providers. And this is right here, the key. Look at the country. At the national level, there are 340 mental health providers for one provider for 340 individuals per capita. In the state, one provider for 300, but Delaware County, it's over 200%. This goes back to what Jen was saying earlier, the lack of resources. It's impossible to scale a treatment solution. You're just not going to get there. This is why prevention and health promotion, mental health promotion is so important. I mean, we didn't even talk about dentists. Ray, do you want to tell us about your dentist? Primary care physicians.
I got an awesome dentist. I have the teeth of an 18-year-old, he tells me.
Well, that probably comes from drinking the water up there. Okay, so this is not meant to be doom and gloom, because this is the very thing we set out to address, right? And this is exactly, when you see the data, in terms of the story, what we did. I hope this is a picture from up there. I think it is.
That's a photograph from the top of Mount Unseanta in Stamford, which has probably 270-degree views. Absolutely spectacular, as you can tell from that photograph in the fall.
And for reasons that we cannot go into, I was not invited to go up there.
I'll take you there if you come out.
I'm happy to go up there.
We'll go in your car.
So Julie has just launched, or just about to launch, a website that has the information about this, and I'm sure she'll talk about it. I do have to jump after a little, I'll stay on for a little bit, but this explains what the programs are. And it explains, you know, what it is, and how it's very interactive, lots of group discussion, lots of communication exercises, lots of self-assessments. And who could be the decider, right? There we are, the decider. That's who we're talking about here. How can we talk and make those people feel really good about helping us, help them? That's really, how can we make them feel good about helping us help them, help their people, help each other? That's another great phrase. We can help you, help us, help you, help your people, help each other. Bada bing, bada boom. More vulnerable, more to gain, but we can help you, help us, help you, help your people, help each other. Thereby making your workload less. So sample outcomes, I don't know where, is this up here too? Did I get this one right? I think so.
I'm not sure specifically where that is. It looks like that could be Unseanta as well, but I'll take ownership of it.
Batting 1,000, everybody. Okay. So what we did was, look, I'm only going to show you sample data, but I do have to upload the case study in the chat box, because, and we do have a number of in-depth, this particular file I'm about to upload, and I'll let Kylene share a little bit about it, because she was part of this. We were contacted, well, not we, but Jen was contacted by Amy Buggs. This is how it works. This is exactly how this works. Why did Amy Buggs contact Jen? Because Bob Murphy has a voice. And he was talking with Amy, who works in workforce development for many years. And he said in some conversation, oh, by the way, did you know that there's resources for stress and health promotion? This is exactly how it works, guys. And she said, oh, there's a plant that's closing here in Cortland County. By the way, I don't know if you know, but Cortland County is historically rife with plant closures. I mean, it's amazing. People, it's almost like the county is a prostitute, you know? I mean, don't repeat that. This is an example of where I can get in trouble. Manufacturers come in there, they build a plant, they make people work, they work them to death, and then they leave and they don't give them anything. Right? So the reason I'm saying that is that, thank God, Amy, just through a casual conversation, said, oh, hey, Jen, I know that Jen, tell the story, and then Kylene, tell the story. This is what I mean. Go ahead.
What time is it in the morning where you are?
It's 9:20.
I have done it wrong. Ray has done it right. He had you speak in the morning. There, you have a lot more jump in the morning. So that mental note.
It's
So-
only because I took the granddaughters to school this morning.
Oh, awesome.
Yeah.
That'll do it.
Yeah, it does it.
Yeah, so I don't know if I would use the word prostitute, but yes, a lot of closures. As I said, when a lot of people left, a lot of morale issues in Cortland. And this was in addition to ARC, we had that investment from EDA as part of the pandemic, right? Pandemic recovery from Economic Development Administration. And sadly, as part of the pandemic, this manufacturing plant closed. And Joel's right, that culture, you know, this didn't all happen by accident, right? Our mental capacity here, these closures. So I called Amy and I said, look, we're working on this Inspire program, but there's an opportunity here. You have to meet this Joel Bennett. I think he can help your employees with, they're going to be hit with a lot of stress in the next couple months. I've been through that personally. IBM Endicott, if anyone remembers who they are. And that plant closure. So for me in Cortland, it was very personal. And if we can keep that community from going downhill, Joel, I know how you know how to do this. And yes, with Bob being the other director of workforce development in neighboring county, reaching out to Amy and really working on, okay, Amy, pay attention to this one. She jumped right up. She worked with the manufacturer, and as Joel said, you know, they employ the people and they just let them go. We have all these benefits in the state. Another policy issue, right? Where, okay, 10 years tax-free, build your manufacturing plant here, but no one thinks about how do you protect those individuals and families if you close up? What's the penalty of that? So thankfully, it took Amy a couple weeks to convince HR to say, let us just talk to your employees as you're kicking them out the door. And I think we only got about half of them, Joel, but you saved half of them, right?
Well, there's a lot to this story. I mean, they were laying off, I think, around 300. And by the time we got there, you know, they had already let go of a lot of people. So it was more a function of that. But I think Cynthia, Kylene, we had about over 100 total in the 2 days of training that we were there. And Cynthia was there, Kylene was there. But this is the story, because it was because Amy had seen how many people keep getting laid off. By the way, guys, if you don't know this, this is one of the root causes of the opioid epidemic. Plant closures and people left to hang out to dry over and over and over again. So I want to just say that Julie talked to the HR director. We had a great conversation with that person at the local plant. Cynthia talked to the HR director. I mean, we were like, you know, full on. Kylene and I and Amy, we all talked. It took weeks. We only had a few weeks to do it because each day that went by, we didn't know if they were going to lay more people off. But we went in there, and this is where I was hoping Kylene and Cynthia could share what we actually did and what happened, because this is the kind of strategy we can, okay. Everything we're doing with Julie's training and efforts is great. Getting people in, getting them trained. But if we can help people like this, because Amy was able to get them food bucks, she was able to get them resume writing training. It was an integrated effort between workforce development, health promotion, right? So this is what needs to happen. So Kylene and Cynthia, can you share what you actually heard? And the case study that I just put in the chat box, gives you some more depth, but I'll turn it over to Colleen or Cynthia.
I was really struck by the vulnerability. You know, we talk about what it's like to live in rural America and the struggles that our communities face. But it's another thing to see a group of people who are in the face of this crisis. They were extremely vulnerable. A lot of these people were people who, you know, you worried for that they were going to, what were they going to do? You know, it's not an easy transition for a lot of these people who had been there for the better part of their career, and to transition to something when there isn't a lot to begin with in a rural community, but the collaboration of all of the resources, people coming together. I think what struck me the most was the impact that the collaboration had, knowing that they had resources. This is where you can get some affordable food. We will help you with resume writing. Just knowing that they weren't alone, and that they had resources, that we were taking the time to talk to them, to provide them with a lunch there. It was really, they were so grateful in the face of potentially extremely stressful times. They were very, very grateful that we were there, and that was very moving to me to be part of that experience.
Cynthia, do you want
Thanks, Kylene. Yeah, I mean, I would just have to echo everything that Kylene just said. I mean, it was super, super powerful. So it was 2 days. So the first day, I believe, was 4 trainings. The second day, I think, was 1 training. And like Kylene said, I really feel that the attendees really benefited from everything that we shared with them. Lots of new concepts for them. You know, we were introducing a lot of really new ideas, and they really, it just really resonated with them. We had breakout groups. I talked with quite a few people one-on-one, and just really, really powerful training. And happy to tell anyone more, offline another time. There's a lot to go into this, but
thanks. I mean, I think there were 3 stories I heard. Several people came up to us talking about their current problem alcohol use. Coming up to us talking about the struggle they're having with divorce. People talking about their medical problems. Weight gain, cardiovascular. I mean, it's like they were saying, where have you been the past 10 years?
I will just interject, Joel, that I had forgotten until you just brought that up, that they were very open. It wasn't even, there was no, not that they should be ashamed, but they were so matter of fact about their alcohol use or their health problems, or it wasn't a factor. It's just like, this is the way it is here. And I also left with the distinct impression that nothing like this had ever been done before for any of these people at probably any of their jobs, but certainly at that place.
And we decided not to collect any pre and post data because we just wanted to give to them. So I'm going to show you some pre and post data from other work that Julie and a number of trainers around the state have done. But I think I had said to Jen, it doesn't make, again, from a policy perspective, it doesn't make sense to give companies special dispensation to come in and create a plant without beholding them to some commitment to helping people if they decide to leave. It's like, let's bring in the money, but we don't really care what you do to our people in the long run. And every one of these people, I know, I mean, they were physically, I mean, we saw the data on Delaware County, right? We saw the data. They were physically and mentally burnt out because of working in that plant, right? There were people there who have been working there for 25 years. Beautiful people, by the way, wonderful people. They were so happy we brought them pizza.
Joel, Mitzi has some questions if you are in a place to be able to.
Yeah, sure.
Who are you sure you want to open this door? Because I have so much to say.
Well, yes.
So first of all, big shout out to your dive into IO Psych. I have to say I walked across the stage just last weekend and got my master's degree in OPsych. So
Yay.
so super excited about what's going on here. Also lifelong resident of Delaware County. And where to begin? What's my first question? Resources. You talk about resources. In my current role, which is not yet using that degree, but we will. I work across a 6-county region, and I am amazed at the difference in human resources collaboration between in different counties and what that looks like. Coalitions that meet once a month, email lists that you get on and that you get in, and I'm ever so inspired by some counties and ever so bummed out by others. And I've talked to a few people. I've talked to a few people who contract, for Delaware County in certain areas. And always we get the same answers, right? We get the same, there's no money, there's no time, we're understaffed. I'm here to say that the research shows us that the nation is understaffed, and the nation has no time, and the nation has no money. So we really have to look at, why is it working? Why is there this great collaboration in this rural county when there's very little in another rural county? We really have to look at those things. We have to look at that perspective and why some people are. There's one county that I work in, I am blown away. There's a few counties that I work in, but they have, recovery to work programs, and that actual grant funded program itself, human resources program itself, hires and employs. Most of the employees of that organization have gone through the program. So, talk about walking your talk and putting your money where your mouth is. Absolutely beautiful. Veterans programs, programs for marginalized communities, programs for new Americans that are lending towards the staffing issues. So that's the first thing I want to say, is that together, working in partnership, there are solutions, and we don't have to stay in this. And believe me, like I said, lifelong resident of Delaware County, totally understand the victim vibe. I get it, and I've lived it, and sometimes still feel it. But we don't have to stay in that place of, it's so hard. It is so hard, yes, and we have each other, so we can figure this out. And I'm loving every bit of it, of this. The other question I have is, and I may have misunderstood, the training that you were just talking about, Cynthia, that you just mentioned, that a lot of people had some really great feedback. Was that for leaders, or was that for just staff?
No, it was for staff. It's for
Okay,
staff.
cool.
But we do have, the follow-up here is with Kylene. So Kylene is your point of contact for getting the training. So, and Julie as well. And there'll be others, trainers as well, but we have several different types of programs. And one can be done just for leaders, if that's what you want. Just so you know.
Oh, thank you. Thank you very much for that. So one of the things that I seem to have found a passion for during my 2-year academics, wallowing in the data, as you know, is I clearly have, and probably always have had, being raised in this community, having a blue collar father who was a 2-war veteran. I seem to have a great deal of passion for the workforce here, and what is or isn't offered to them in the form of resources, empathy, understanding, inclusivity. So my question, I know, part of what I did was to create an argument and a program of why psychological safety in the workspace is a worthwhile investment for organizations, for small businesses and small organizations, and just showed some correlations with productivity and retention. And because at the end of the day, it's about dollars, right? To some people, keeping your business going, it's important to sustain your business. So my question is, after this training, this wonderful training, what are the efforts, or have you approached yet how you will sustain that training, how you will continue to support those people? Because there's a high, we know from the data that high touch and high engagement on a consistent basis gives the best outcomes.
Yeah.
So what I'm wondering is, a lot of times, and I've been part of them, I've even given the trainings become performative, because you go in, you do this great training based on some really great stats, but then you leave. And what we're dealing with are these heavy, heavy artifacts that are lingering in our culture from old leadership styles that are no longer effective, old business and organizational styles that are no longer effective, and even old stigmas and perspectives of addiction, of stress that are no longer effective.
Yeah.
Like pull up your bootstraps and suck it up and get to work kind of thing. So how are you guys planning for, or have you already?
Well, there are a number of ways to answer that. I mean, the true answer is you already gave, which is, you asked the question, how can this work? Why are some coalitions doing more than others? And the answer to that is the answer to your question. And I don't want to sound, like it's a magic wand, but it's really about chutzpah, gumption, and getting together. That's what it's about. Those, you can quote me. Chutzpah for those people on that side of the tracks, gumption for people on the other side of the tracks, and Helen's on both sides, and collaboration. And so what
Joel,
that's the first answer. Yes.
can you spell chutzpah, please?
CHUTCPAH.
Sorry, go ahead.
There's a ch. That's the first thing. So sustainability is related to what you're talking really about is transfer of training. How can what they learn be sustained over time? We know, and we could spend the whole day on this, so I'll be very brief. If you have people who are following up, who have the resources, who say, thank you for coming to that training, and you do a booster session 6 months later, Mitzi. But there has to be the resources. Hey, if you do get let go, here's workforce development. So they need to know about it. The chamber everybody has to be part of the solution. That's the first thing. The second thing is the training itself. I'm going to send in the chat box, since you let the cat out of the bag that you do research. Our program should ideally be done with a team of people who work together. That's what we did up in Delaware, up in Cortland. Because what we have found in our research is that we're not just dealing with the individual. In that lower left-hand corner, we're dealing with the team. If you change the climate of the organization through a team-based training that at least 60% of the population get, it's more likely to take. That's a second thing. So that's the data, that's the research study that we just published. Third thing, you have to do everything you can in your power to have a full service EAP. not one of these 800 numbers. Or you really put together an incredible resource guide for your county working with United Way, 211, and make sure it's up to date. Because what we find is that once you start reducing the stigma, it's not like people don't want to use these. They do want to use these resources. It could be childcare. It could be Catholic charities. It could be, it could be, but there's so much like, victim and shame. But once you start having this conversation, it's just like, oh, okay, I could use that. It's not a big deal. But you have to be able to, your trainers have to know what those resources are. Right? So that's what we have found. And that's not a magic wand, but doing those three things, especially the chutzpah part, and that's why Ray's here.
Well, and I guess my question was not so much the how, it's the how are you executing it? What is there a team? Will there'll be this team that is doing this training, or the work that Ray's doing, and whatever the chamber's putting together? Is that sort of a medium and long range plan is to continue to support this?
Yes. Well, with the funding that's available, I think the best thing for you to do is to have a follow-up conversation with Kylene and look at how you can get involved. It's really about that. It's just how can you be an advocate? What can you do to bring in pizza? I'm serious.
And I'll add here, Joel. And then when you find out where you want to have the pizza and which group you'd like to work with, then we can help finance that. And Joel gets frustrated in this too. We've had hours of conversations, these grants come and go, they end, and then it's over with. That's part of where Julie stood up, and by building the local team awareness training, taking what Joel has given to us and expanding that. But also there's other opportunities for Joel to work at this. So we're constantly, okay, how do we do this here? We're going to take a look at, there were 3 investments across the region. How do we expand upon those and sustain those? Mitzi, and would you send me your email? Because I'd be so interested in what the counties that you work with, and rank those in capacity where they're at. And as Joel said, it's having those conversations, because each time you have a conversation with that person, then you realize how they're helping in the overall ecosystem. All right, Joel, I'm sorry. I'll let you.
No. I mean, Mitzi, you could be trained as a trainer if you want.
Yeah.
You want to be trained as a trainer, Mitzi? Okay. I'm pretty much, the last slide, I know we're about done here. But I think I'm being serious. There's so much that we have now. It's just a question of people stepping up at this point. And how do they want to participate? Do you know somebody? Do you know leaders in the community that you can send to Kylene to do a stakeholder interview with, right? Do you have, your brother's cousin, would he like to be a trainer? Go ahead, Jen.
I do want to add one more thing that's happening in Delaware County. So in July, from July 10th through the 20th, there's that innovative readiness training program. And thankfully, Delaware has been very supportive of that. Julie will be tabling there. This is the first time we're bringing the military, thank you, Ellen, for the mental health initiative. Thank you, Ellen. And I hope that really helps Walton. There was a reason that the military chose to work with us in Walton, because they saw the lack of resources that we have here. So hopefully that's a really good, another landing point to meet folks.
I will actually be there, and I will also have our mobile cancer screening coach there.
Oh, awesome. Okay, great. Thank you. I get excited when I saw your email, because Bassett, we've been trying to work with the healthcare providers. Our challenge was the pandemic hit too, and we had a shift, they're like, we're really maxed out right now. And they were burnout, like Joel describes the burnout in the manufacturing plants with the hospitals as well. So, okay, well, thank you.
No, as I said, I'm done. I think the only data I was going to show, I don't have to show it, is that over and over and over again, we see the same result. People now, they increase in their knowledge of where to get help, and they're more willing to get help. And that often translates into getting help or getting better. So, it's a health promotion training, not a substance abuse, mental health, gloom and doom training.
I'll add that I don't know why. I feel like it's important to add that while I work for Bassett, Bassett holds the grant for the program that I work for. It's a state funded grant. So I work both in and out of the Bassett Healthcare Network. We have contracted providers from other networks. So I get to see this great I get to compare a very large region. And I will also say with the comparison of small to large business, I have such a heart for those results and feel it in my community, feel it in my neighborhood. But I will also say that one of the things that came out of the pandemic is that even large organizations, Bassett is over 5,000 employees, even large organizations aren't escaping anymore the negative impact of these issues. And even just in organizational psychology in general, organizations that haven't innovated and stayed relevant to the issues of today, whether it's COVID or not COVID, but whether it's substance abuse or economic issues, if they haven't stayed relevant with the social structure of the time, if they're still going, they're riding on yesterday's successes, and that just goes so long that eventually that juice runs out. And I've worked in organizations where that's happened. So I'm so excited about this, and it's really a great time, I think, in history for moving on these things.
Yeah, Mitzi, I want to have the last word. I'm going to have the last word. You are correct, and now you have an evidence-based tool so that whenever they talk about it, they can put their money where their blankety blank mouth is. Because there's so much talk, but we have actual evidence-based tools. Look at Julie, she's beautiful. Look at Kylene, oh my God. You want these people in front of your people's people.
Well, I'm going to interrupt you before you really get into trouble here. Before you go, would you tell us a little bit about the Connoisseur of Time and how folks can get a copy?
Well, again, presencequest.life. Thank you. So after doing 25, 30 years of work in this area, not after, but how present, okay, how can I tell you? How present are you right now on a scale of 1 to 10? Okay. Lily, my work is done. Okay. So the issue here is that people just are not present. Social media, if you got to get people to show up, right? They're tuned out. And a lot of it is on the back of clock time. So what the Connoisseur of Time is, how do you transform your attitude toward time? Because the research shows that the more you're not wedded to clock time, the more you'll have mental health, happiness, and joy in your life.
Thank you. Thank you. Unfortunately, we are a little wedded to time here on this program this morning. Joel, thank you so much for spending for being so gracious and generous with your time this morning and speaking to us about those issues. Our next speaker is Dawn Lanowet, and Dawn, I apologize if I mangled your last name. Dawn is a partner in the law firm Hinman, Howard and Cattell, and she's going to give us a labor and employment update on substance abuse and recovery in the workplace. Dawn?
Thank you. So I've been talking about this topic for a long time with Julie, and I thought I would expand it just slightly, and it seems that it will dovetail nicely with what you've been talking about this morning in terms of mental health and substance use disorder and where we are in the workplace. So I approach it a little bit differently than everyone else because I'm a lawyer, and so I'll primarily be talking about the legal issues for employers, but nobody minds a cute cat picture, right? So what are we seeing in the workplace? A few statistics. 20% of US adults experience mental illness each year, and 26% of working Americans report they hide their mental health struggles from supervisors. So those mental health struggles are important because they often lead to substance use disorder. We've got 43% of employers are reporting an increase in reasonable accommodations related to mental health. 51% of employers report that their employees have increased reports of burnout or mental fatigue. That's absenteeism and higher turnover. Families are struggling. They've done a lot of surveys of teenagers recently, and there's a lot in the news media about mental health of teenagers and social media. But actually what they found is that about 55% of high school teens reported violent abuse or psychological abuse at home. That's about a 3 to 4-fold increase from 2019. Parent age adults, there is now an increased rate of suicide. It's about 3 times what it was. Alcohol and overdose rates, 3 times what they were. Depression rates, 3 times what they were. And understand, this was a population that prior to COVID was not as susceptible to drug and alcohol overdose deaths. Parents, they tend to have many reasons to stay around, namely those children. But that is sort of going away. Drug and alcohol abuse, I'm sure somebody's already shared the statistics. 2022 statistics from the National Institute of Health: 140,000 deaths from alcohol, 110,236 from overdose. That unfortunately was an increase. Prior to COVID, we started to see a decrease in those overdose deaths, and now we've got shot way back up. So I don't think we can ignore COVID's lasting impacts on our workplaces. And that's what I tell employers when I meet with them, when I train their supervisors. I'd like to be that guy sitting there, maybe with my eyes closed, but that's just not reality. And so, I share this with employers a lot. This was published and it made its rounds at the end of 2022 in December. And I thought it really described where most employees are. Nobody began the year on a full tank, and we've really sort of escalated what we've done. And I won't read all of this to you, but it's certainly available. The busier we get, we hope the more we'll forget what happened during COVID, and we can't really do that. And so we have a mental health of employees that is really in tatters. Picture, this leads to it too. So how is that affecting workplaces? It increases absenteeism, performance issues, healthcare costs, and workers' compensation costs. Mental health versus mental illness. It's important to understand that, and I explain that to employers when I meet with them. We can have someone who has a mental illness that can have good mental health. It's treated. They meet with a counselor regularly. Perhaps they have medication. They have a support system in place. We can also have someone who does not have mental illness who still has poor mental health. They don't have a support system. They're struggling. Or maybe they're using substances to compensate for the difficulties that they're having. So what legal issues then come up? Well, the basic rules depend on the substance we're talking about. When we're talking about illegal drugs, testing is legal for employers, termination for use is legal, and there is no protection for an active user of illegal drugs. If we are talking about alcohol or marijuana, marijuana is legal in New York, so the issue is impairment. Employers cannot just test unless they're in one of the job categories that requires drug testing, such as transportation, CDL driver. They cannot just randomly test for alcohol and marijuana. They have to have reasonable suspicion in order to test. So the issue is the employee impaired at work? And if the employee seeks rehabilitation, that requires accommodation. So there are limits to testing. Prescription drugs, which are still a problem for many employees, an employer can't even ask unless the job is safety sensitive, and an employer must accommodate their use even at work. So the testing can only comes into play if the medication is not being used in accordance with its prescription. And then I'll tell you, recovery is different. So when we have employees in recovery, both their mental health, potential mental health issues and their recovery from drug and alcohol abuse are considered disabilities and must be accommodated in the workplace. We'll talk a little bit more about what that means. There are a number of laws in New York that apply: the Americans with Disabilities Act and the New York Human Rights Law. One is the federal and one is the state law. Family and Medical Leave Act applies to employers with 50 or more employees and can provide a leave of absence both for the employee's own medical condition, which includes attendance at rehab, and for a family member's. Paid family leave for a family member would be available. Labor Law 201D applies to off-duty activities, and as much as it may not seem like it applies, New York Corrections Law 23A is important when we're talking about somebody who has a history of substance use disorder, because they may also have convictions that are related to that substance use disorder. And New York does protect and require employers not to discriminate against employees for convictions unless the employer can show it is related specifically to the job. So just some information, and I've tried to put citations in here in case you are meeting with an employer or you're talking to somebody at your workplace about this. Federal law: employers cannot fire, refuse to hire, or refuse to promote someone simply because they have a history of substance use. Can't fire, refuse to hire, or refuse to promote employees merely because they are enrolled in a drug or alcohol rehabilitation program either, or because they were in the past. So non-discrimination is the law. Accommodation is also the law. Accommodation requires, and I should have had a slide that sort of clarified that, but accommodation requires an employer to make reasonable accommodations. That is, some change to the job that allows an employee to perform the essential functions of the job with or without that accommodation. And so, you know, the EEOC has some guidance on how that might play out. I like to talk about it a little. I'll talk about it a little bit more practically in a minute. There are also leave laws: Family and Medical Leave Act. 50 or more employees, the employer has an obligation to suggest this to an employee if they are indicating they are struggling or a family member is. Employees in New York all have New York paid sick leave that gives them time off. Disability in New York for employees who are employed who go to rehabilitation, they can qualify for disability, which provides payments for the employee while they are out of work, and paid family leave if it's a family member. Accommodation is an interactive process. So an employee makes a request. I need 30 days off of work to attend a rehabilitation program. Or often the request is, I've been in recovery and I need to leave Thursdays at 3 o'clock in the afternoon for an hour to attend an AA meeting. This is a conversation between the employee and the facility, and usually we get some medical documentation or some documentation from the AA program that it in fact occurs at that time. We can make a provisional accommodation, so an employee might ask for the opportunity to work from home because for them, working in the workplace is more stressful. And you could try that out with the employee. The reality, and if it doesn't work, you can end that accommodation. The reality is that the only exception to accommodation is undue hardship. Undue hardship is more than a de minimis financial obligation to the employer. It's actually significantly more. You really do have to show it is a hardship to the employer, and that's based on the employer's size and their business. So I always tell employers the question should be, can we accommodate, not how do we not accommodate, right? So the first question is, can we accommodate this? What can we do? Here are some possible accommodations for mental health issues: telecommuting, part-time, flexible work hours, additional or flexible breaks, changes to the workspace. I've dealt with employers who have had requests that an employee's workspace be maybe on the end because they're more easily distractible. Maybe it has a door, maybe it has certain lighting requirements that help them. Equipment, modifications of non-essential duties. I've included emotional support animals there. New York does allow emotional support animals as an accommodation in most cases. And what about drug and alcohol specific issues? Time off to attend sobriety meetings, NA, community-based therapies, AA, any of those. There's plenty of case law that says that employees have that is a reasonable accommodation in most cases. Time off from medical appointments, allowing employees to avoid social events where alcohol is served is an accommodation. Sobriety coaches or job counselors on site is an accommodation. I've had employers deal with each of these. Medication-assisted therapy, there remains a persistent view among some employers that an employee who is using methadone or Suboxone is somehow impaired at work. That's not actually accurate. They are not. This is medication that normalizes brain chemistry and helps relieve physiological cravings related to primarily opioid addiction. Employers often need to understand what this means. I mean, the employee may have to have a daily visit to a clinic. These medications are so highly regulated. So the employee may have to actually daily go to the clinic. That might require an employer to accommodate those medical appointments, might require them to accommodate the employee being able to take their lunch break at a different time or be absent certain days of the week. That's just a definition. Must an employer accommodate medication-assisted therapy? The answer is yes. The EEOC has routinely sued employers for their refusal to hire individuals who are using Suboxone or methadone or other medications. And there's just some more information on that. Here's the EEOC statement. I thought that might be helpful. As the country grapples with an opioid addiction crisis, there are many myths and biases about people recovering from drug addiction and the treatments for it. Under the ADA, employers may test for illegal drug use, but medically prescribed Suboxone and methadone are not illegal drugs. What do employers not have to accommodate? Poor performance, disruption in the workplace, somebody who has outbursts or who doesn't show up, absenteeism, failure to adhere to reasonable workplace standards. And the focus is on the work performance. It is not on their mental health or on substance use or substance recovery. The focus for employers should be on performance, not any of those issues. What else can employers do in the workplace? I increasingly have employers asking for training on these issues. Training for their supervisors on what they can do, meeting to discuss what kind of plans they can come up with in the workplace. So I start with the 4 A's with them. Do we have awareness of what the issues are? Do we have accommodations? Do we have assistance for our employees, and do they have access to necessary medical care? We've talked already kind of about accommodations and what those might be, and when I meet with employers and their supervisors, I talk about those too. But probably the key one is awareness. And I heard somebody say something about I don't know if that was Joel or somebody else, the 1-800 EAPs and their stigma. Building awareness is largely about tearing that stigma down. So normalizing conversations about mental health, normalizing conversations about using the EAP program, knowing the resources and make them accessible. When I do training for supervisors, one of the things I ask them is, who could tell me 4 resources that are available in your workplace? And I'll accept 4 answers off. These are 4 things the EAP can do. And the supervisors never know. Well, if they don't know, then their employees don't know, right? So we have to have a culture where this is talked about. So some of the things we do at my law firm, and some of the things that I've seen other employers do that are successful, having mental health minutes. We joke in healthcare, you know, there was the safety minute every day, or in construction, there was the safety minute. And then there was the take a breath, right, in healthcare, and make sure we got the right surgical site. Well, now we need that mental health minute. Are we giving employees information on a regular, ongoing basis? Lunch and learns, these can be remote, they can be in person. Having a speaker talk about mental health issues, how to handle stress in the workplace, what resources are available to employees outside. Super important. 15-minute programs, I've seen some employers have success with those. Let's give our supervisors some words to use. So how can we have a behavioral issue? We have somebody who's late all the time. How can we support you in changing this behavior? So I as an employer cannot accept that you are late every day, but how can I support you? That might mean flexible work schedule. Well, the truth is I can't get here because by the time I take care of my child and I go to the Suboxone clinic and I get here, it's 9:15 instead of 9. Okay, well, let's make your schedule start at 9:30 and end at a different time and give you a half hour instead of an hour lunch and see if that works better. Reaching out to employees, what are you struggling with in our workplace? How are you feeling? How can I help you? And if there's an issue, you know, this may be awkward, but I care about you. I won't raise it again, but it certainly seems you need help with whatever. So those are all conversation helpers. And I encourage supervisors to print them out, keep them in their desk drawer so they have them really available. This is not easy. This is not stuff supervisors are trained to do, right? They're trained to do their job and to tell employees how to do that job. They're not trained how to manage employees. And we really have to do that. EAPs are an important part of these programs. So, you know, we have to talk about the employee assistance program, what is available to the employees at a business, how does it work? And I'll talk about the legal issues as well. I love the idea of, if an employer doesn't have an EAP, coming up with resources that are available through 211 and other places for employees. That's really important. So EAPs are typically confidential. Federal law protects any drug and alcohol records, and that's important to get across to employees. New York state law and federal law also protect counseling records. Here's the number one misconception I think employees have. They think that their employer knows that they use the EAP. So if the method that we are using as employers to support employees who may have substance use disorder or other mental health issues is the EAP, we really have to make clear to them that it is confidential, that all we get is aggregate numbers of 30 people accessed counseling services over the course of a year. And why do we get that? It's so we can direct our benefit dollars where they matter, right? But employees do not believe that this stuff does not get reported back to their employer. And if they don't believe it, they won't use it. I've actually taken the tactic of having the EAP come in and say it. I think it's more effective than me saying it. There are no legal issues for a self-referral or an informal referral. So a self-referral is, I decide I want to use the EAP and I call it, no problem. Informal referral is my supervisor says to me, hey, you know, Dawn, I think you might benefit from the EAP. Here's the information. No problem. Mandatory referrals, those have some legal issues. You need to document the reason for the mandatory referral because they can lead to an ADA claim of a perceived disability. And if you are expecting to get back as an employer information from the EAP, then you need to make the employee aware that there's no confidentiality. The mandatory referrals are usually used only in cases of like self-harm, serious concerns about harm. I rarely see it in the area of substance use because if an employee is unwilling to go on their own, it is unlikely to be successful to force them to go to counseling, right? Doesn't work. Other issues for employers, the disclosure of drug and alcohol issues. So I have a problem. I want to go to rehab. I have a problem. I don't know what to do. Family and Medical Leave Act applies to those circumstances. So if the employer has 50 or more employees, that would be covered as a medical condition of the employee. And the employee would be entitled to their 12 weeks. It's unpaid, but their 12 weeks of leave. That's why I mentioned disability, because you can get disability and FMLA at the same time. And so the employee would at least get that. The employer might have other paid leave that would be applicable that would help the employee, because that is, of course, a concern for employees. If I go to rehab, like, you know, will I get paid? How do I pay my bills while I'm gone? So that's important. Self-disclosure protocols are something that I have encouraged most employers to include in their drug and alcohol policies. This is the option for an employee to disclose that they have an issue and keep their job, right? So we won't terminate you if you disclose. It doesn't apply in the circumstances where the employee is being terminated anyway, or is already on the chopping block. But an employee comes to us and says, I have a drug or alcohol problem. I want to go to rehab. Okay. We will give you a leave of absence that is the same length of time that is recommended for you to attend this treatment center. We can't guarantee you'll have a job when you come back, but we will try to restore you to the job you had, or we will put you at the top of our list for rehire if that job's not available, and we'll work with you on that. What is the benefit to the employer? I mean, look, we can't find people. Employers can't find employees. And there is a lot of research out there that employers who support employees through recovery have a much more loyal employee. They reduce the cost to them. Employees in recovery actually have lower absences rates from work than your average employee. And so there's plenty of research out there that supports helping employees through recovery. The other thing an employer might be interested in getting in return is the opportunity to drug test. That's not available to employers generally. They can only test, typically can only test for impairment. But if an employer has a self-disclosure protocol and they allow an employee to go to rehab and bring them back, that bringing them back can be conditioned on signing an agreement that agrees to drug testing. And for some employers, that is a trade-off that they're willing to have. Preserve a valuable employee, but have some kind of assurance that this employee is in fact sticking to their recovery and their plan. One of the things I see a lot of is family member drug issues. My son has an issue. My daughter has an issue. I have a sister who's struggling. So there is leave available for that. New York paid family leave would cover an employee who is taking time off to assist a family member, maybe getting settled into rehabilitation, maybe helping them get treatment for that, helping them make transportation arrangements, right? Driving them to and from treatment. That would be available to them, and that's paid. And New York paid sick leave is also available, although it's pretty small, only 5 days max. Do employees understand the EAP program? Do they understand the resources available? I mean, that really requires employers to be willing to do supervisor training. It requires them to have their supervisors use the EAP. You'd be surprised what's available through EAPs. Some of them have shopping discounts. A lot of them have financial counseling, and we often underestimate the stress of financial on our employees. You know, if we can help them get that under control, maybe they are using their substances less or not at all because that stress has gone away. So supervisors really have to be trained to know what the resources are in the EAP. You have to have some regular meetings with your EAP provider, have them come to the workplace, and then that confidentiality is really important too. Here's a couple of resources that I think might be helpful. The Job Accommodation Network training has some training and information for supervisors, mental health awareness training. That also includes training on substance use disorders in the workplace. And then the National Council for Mental Wellbeing's Mental Health First Aid at Work has some different training for supervisors and also just some ideas for things employers can do to help support employee mental health at work. And that, of course, includes helping employees who have substance use disorders. I'm happy to take any questions you have. That went a little faster than I thought it would.
Don, it's Ray Pucci. You know, a lot of our small or micro businesses just can't do an EAP. One of the things that in my notes from this morning is I'm going to start investigating how we, you know, is it possible to create something of an aggregated EAP that I can offer to chamber members. Are there models out there for such things?
I believe there are. I know that there have been discussions about doing this. I think there might be a couple of chambers who have done it. I see Julie nodding her head, and I think she worked on one at one point that provided sort of some, you'll hire employees and we'll provide you support models. If Julie wants to talk.
Actually, the reason I was nodding is that some of the staff from Washington, D.C. reached out to me about, from ARC reached out to me to ask me about what would be my wish list about funding for moving forward with this recovery ecosystem work and this well-being work. And I told them that one of the things on my wish list would be funding to help support local chambers and local partners to be able to create EAPs within the community that supported the community, rather than, I mean, as an adjunct to businesses who already have their own EAP.
Yeah.
Because small businesses of 10 or under don't have the funding to pay for an EAP. And the idea that chambers and local partners could come together with some nice beefy seed money to start an EAP may be the way to get coverage for that might not otherwise be available. I don't know how far up the chain that went, but I had a conversation with some folks.
Thank you both. Gives me something to investigate and see what we might be able to do.
It doesn't seem like it would be any harder than doing group insurance, right? I mean,
It should be along the same lines. It's just a matter of funding. Always.
It's always, isn't it? Other questions? Other questions for Dawn? Comments? Well, Dawn, thank you so much for that insight and all that information. Absolutely tremendous.
Mhm.
Now we come to the inspiration part of the program. No pressure here.
None.
Julie Dostal is the executive director for LEAF, and I'm thrilled that Julie and I have been able to partner on some of these efforts over the last few months here. And Julie's going to talk about truly that transforming power of recovery to work, or work to recovery. I'm not sure which. Julie.
Absolutely. Good morning, everybody. Like Ray said, I'm the executive director of the LEAF Council on Alcoholism and Addictions. I have been in upstate New York since 1992. And one of the interesting things about that date for me is that I was in very, very early recovery when I moved up here. I'm a woman in long-term recovery. This year is 30 years for me. And yes, hooray for recovery. And I struggled with both alcohol and other drugs in my addiction. And kind of crawling up out of that was a tough place to come from that as not only a person in my early 30s, but as a young professional trying to get a foothold in my career path as a person who was in early recovery and just trying to get my legs underneath me. And at that point in time, I don't think I knew better, but I told my prospective employers that I was a person in early recovery as I was doing interviews. And this particular interview was a higher ed interview. And if you have ever been through a higher ed interview, it's like 2 days of going through every group on campus, meeting people. And I just let them know that I was in early recovery. And at that time, I did, and I still do. I saw my recovery as an asset to the work that I do. And they took a chance on me. And that was one of the best things that could have ever happened for me in my career and in my life, that an organization said, well, here's a person who's come out of struggles. She's up here doing the interview, and let's give her a shot. And I am so very grateful that they did. I had no idea the path that my career would take. I thought that I was going to be a therapist hanging a shingle and do private practice for the rest of my life. And oh my goodness, here I am doing community work and talking to businesses about workplace well-being. And part of that is because this work is so personal to me. If I had not been hired into a workplace where my recovery was supported and encouraged, I'm pretty sure that I might have taken another path in my life. So I am here because recovery-friendly workplaces mean something. I am here because healthy workplaces mean something. And I can promise you that if you work with people more than 20 minutes, you have probably run into someone who has struggled with addiction. You have probably run into someone who has struggled with mental health. And you have probably run into someone who is in recovery from one or both of those. Typically what happens is those of us who are in recovery, once we get our feet under us, we don't talk about it a lot. We just happen to work in society and function in society. I will also tell you that people in recovery from mental health struggles and people in recovery from addiction who are hired by employees that by employers that believe in them are a grateful population. They are a grateful population who show up for work, who do the work they're asked to do. And that's, there's a workforce out there that is untapped, often because of stigma related to substance use and substance misuse. So I am very happy to be a little tiny bit of an ambassador for the idea that the stigma associated with substance use and substance misuse does not have to carry over into the workplace, that this workforce can be an awesome workforce for change in each of our businesses. And so with that, I want to tell you a little bit about the work that we're doing with team awareness. It started with some work that we began years ago. You know what, Jen, it seems like a lifetime ago, because it was pre-COVID. And I think our whole rest of our life is going to be pre-COVID life, post-COVID life. And we had started some work in Oneonta with Friends of Recovery of Delaware and Otsego County on recovery-friendly workplaces, and really trying to get the recovery community connected to employers and matching those folks up. Jen heard about our work and Jen said, will you please come talk to this event? And so we came and talked to this event, and then that kind of got some excitement and energy up. And from there, Jen and the Southern Tier 8, they were forward thinking enough to go ahead and try to apply for some funding that maybe we could make this regional, maybe possibly we could try to do this thing and make it real. And we started doing this thing. We contacted Dr. Bennett. We started to pull partners together, and now they say the rest is history. So I would be remiss if I didn't say I've got partners, awesome partners on this call. So Ellen Davis is here from ADAC of Delaware County. They have trainers right in their organization that are being prepared to do this team awareness work. We've got Patrick over from the HFM Council that's on the kind of the eastern edge of one of our regions that we work on. And of course, Kylene and I work together on this team awareness work, and we do evidence-based training for the workplace. And the whole idea that Joel was talking about is that there's this individual piece that we do. When we do these trainings, we're talking to the individual about managing themselves in the midst of stress. We can't manage. I'm not so much a believer in stress management anymore. I am much more a believer in managing myself in the midst of stress. And then talking to that group of people that we're working with about an overall healthier workplace climate. That's the environmental piece. And then if we could talk to the leaders of businesses about policy decisions, we've got the trifecta of the individual, the environment, and the policy. So if you are interested in having us come talk to you, Kylene can do a business assessment with you and find out what your needs are. We have 3 different trainings that we can offer you, and we can walk side by side with you through this workplace well-being piece that we do. It's good work, it's fun work, it's hard work, and it's rewarding work. And we are very fortunate to have the support of Southern Tier 8, as well as New York State Office of Addiction Supports and Services. And for right now, this is grant funded. And so it does not cost businesses a penny for us to do this work with you. And I could not be happier. So give us a call, send us an email. And with that, I will send it right back to Ray.
Well, Julie, thank you. And thank you for all this good work. Are there any comments, final questions, comments from anyone who's on the call? Well, seeing none, I want to thank our presenters, certainly, Jen Gregory, Joel Bennett, Don Lanorette, and Julie Dostal, certainly, for participating in this morning's program. And thank you for sticking in with us for the last 2.5 hours. I mentioned that we've been recording this. We'll make this available. You'll all get copies of it, or at least a link to where it resides in its entirety. I hope that we'll be able to kind of slice and dice this up a little bit into maybe more manageable segments that folks can use, and certainly again, I'll be sharing that with all of you, and share it with your network, and let's spread this good information, this good news, this good effort. I know I've coming away with quite a long to-do list, so we'll be talking, Julie and others, about how we might continue this emerging partnership. Thank you all for joining us. You can get more information about this from going to leaf.org. Did I get that right, Julie?
Leaf Inc.
Thank you.
Leafinc.org.
.org, and certainly DelawareCounty.org is another place that you can go for. That's the Chamber's website for some information about resources. Thank you all again. Let's have this session just as a start, and let's keep building this effort. Thank you all.
Thank you.